Hello everyone, I am Dr. Arif Akhtar and today I welcome you all on very important discussion. So the discussion topic for today will be, can women get pregnant after kidney transplant or even after donating a kidney to the family members or the dear one? The answer is yes, but it comes with some important scientific facts what you need to know about. Let's begin. So first, during advanced kidney failures or chronic kidney disease, fertility significantly drops. In fact, a study shows that over 50% of the women in the end-stage renal disease develops abnormality or irregularity with their menses or complete amenorrhea. Amenorrhea means complete cessations of the menses. This happens because kidney failures patients develop disturbance in the hormonal balance, affecting ovulations and menstrual cycle. However, after a successful kidney transplant, things change dramatically. Research shows that over 90% of the women regain normal menstruations within 6 to 12 months after transplant. This is very significant. That's the reason why the only treatment of the CKD or the end-stage renal disease is kidney transplant. So yes, fertility does return, but it comes with a clause. But can you plan pregnancy immediately after transplant? This is the questions most of my patients generally ask, especially the female patients. No. The answer is no, not immediately. Medical guidelines, including the kidney disease, generally suggest if I quote one of the important studies like Improving Global Outcomes 2021 guidelines, that recommends that the women should ideally wait for at least 12 to 24 months after a kidney transplant surgery before trying to conceive. So the questions most of my patients ask, why wait? So the answer is because this first year after kidney transplant is very critical in terms of the graft functions or the kidney functions. So the organ rejection risk is highest. Immunosuppressive medications or the drugs we give needs stabilizations. Infection risks are very high or very elevated during that period. So global data shows that the pregnancy conceived within the first year after the kidney transplant have up to 4 times higher risk of graft loss and complications. This I am quoting from a very reputed journal, American Journal of Transplantation 2022. So waiting not only protects the kidney but also improves the pregnancy or the fertility outcome. Now what about kidney donors? So the donors is basically a healthy individual. So many women who donate a kidney worries whether they can conceive normally after donations to the near one. Scientific studies have answered this very clearly about these queries about whether we can, after kidney donation, whether I can conceive normally or not. Yes, the kidney donations does not prevent pregnancy. So in 2014, a landmark study was published in JAMA, Internal Medicines, followed by over 85,000 live kidney donors, and they have found that the donor has a slightly higher risk of gestational hypertension, that is blood pressure increase during the pregnancy time, and preeclampsia, that is around 5% higher as compared to the non-donor. But the overall rate of the healthy pregnancy outcomes remain very high, which is over 90%. In India, too, the Indian Transplant Registry data shows that more than 95% of the female kidney donor go on to have a safe pregnancy post-donation. This is very significant. That is 95% of the females who are donating their kidneys to their relatives or the dear one can conceive normally. However, a donor must maintain regular blood pressure check during the pregnancy time because preeclampsia can sometimes develop in such kind of patients. Now medicines. To an important point, what about medications? So after a kidney transplant, most women are on immunosuppressive medicines. These medicines are given just to prevent their body to reject the foreign kidney. Some medicines are unsafe during the pregnancy, particularly if I name some of the medicines, that is mycophenolate mofetil, MMF, is associated with up to 45% risk of birth defect if continued during the early pregnancy. Therefore, the transplant physician usually shifts these patients to some other drugs like azathioprine or tacrolimus or even a low dose of steroids. All of these are considered safe during pregnancy. But The catch is the medicine switch must be planned at least 6 weeks before trying to conceive. This is very important because the effect of the medicine can sometimes extend beyond 6 weeks. So stopping medicine on your own is dangerous. It can lead to graft rejections and we can lose the graft kidney. Now, what happens during pregnancy after transplant? So there are certain changes inside the body that can happen during pregnancy after transplant. Pregnancy is considered very high risk and requires a multi-specialty team approach. You will need regular monitoring for your blood pressures, for the kidney function, especially serum creatinine, your urine protein levels, and of course the blood sugar levels. As I have told you previously, that gestational diabetes, that is diabetes onset during the pregnancy, risk increased by almost 20% post-transplant. Now, study reports that 70 to 80% of the transplant recipient have successful live births. Most of the delivery happens, that is the delivery time happens around 34 to 38 weeks, and about 60% are mostly vaginal deliveries. If I take the data from India, according to the post-transplant pregnancy outcome report 2024, the live birth rate among the transplant women is around 72%. And overall maternal kidney functions remain stable in over 85% of the cases. So what are the key precautions what we need to take? Always work closely with your nephrologist and obst doctor. Regular ultrasound monitoring is a must and necessary. Blood pressure control is critical to prevent the complications like preeclampsia. And one more myth busting point is the breastfeeding after kidney transplant is usually safe if the medicines are compatible. So these are the important topics that we need to keep in mind while we are planning to conceive after kidney transplant. WHO guidelines encourage breastfeedings under medical supervision. This is most important and you need to take care of this. So friend, to sum up, yes, pregnancy after kidney transplant is very much possible, but it needs careful timing, planning and monitoring. Similarly, donating a kidney does not stop you from becoming a mother, with a little extra care that is required. With science, careful planning and medical support, motherhood dreams after kidney surgery, after kidney transplant surgeries are absolutely achievable. If you found this video to be very informative, do like, share and subscribe to my YouTube channel for further patient awareness video series. Thanks.